Hi, benchwarmers. How are we? I don't know why I'm asking. You're not going to reply.
They can't reply to us, Hannah.
So, all right, Beck, what are we chatting about today?
We're going to chat about some red flag, green flags in a few different ways, I think. I think, more importantly, we're going to talk about some red flags clinically that we see and what our listeners might want to potentially look out for in themselves.
Yep.
Kind of thing. But yeah, I think it's just things that, clinically just don't really add up.
Makes sense. Yeah.
Makes sense.
So red flags basically are like serious pathology. So not musculoskeletal for those people that don't know what they are. So done a little bit of research, I guess, about it in terms of like just seeing what they are, because I guess different unis will probably teach different things.
Yep.
Was able to find 163 things can be classified as red flags, but the difference between knowing whether it's a red flag or what we'd call like a red herring is basically the context that it fits in and if it fits a clinical picture.
Yeah.
Do you know, or do you want to chat about like what, like, I guess red flags are, like what we're looking out for?
Yeah, I guess so. Oh my gosh.
We've got the cheat sheet in front of us.
It's a bit of a cheat sheet. Obviously, red flags you kind of get from this objective, which is, when you're talking to the patient and you're trying to get the clinical picture of what they're kind of telling you. I think there's a lot of things to look out for. We're talking more along lines of like threads or just like,
Yeah. We can go through
like,
threads and...
Well, even, like, I always start with mechanism of injury.
Yeah, and that's a big one, yeah.
If there's really no
mechanism,
you're thinking, okay, but why are you getting this pain?
Yeah,
I guess.
So, like, I guess, again, like, mechanism of injury is a term that we'll often use basically if there's a reason or something that's caused the incident. So, like, if you come in with knee pain, we're looking for, if there's, like, some kind of like ligamentous injury, you're looking for like, your ACL is like a clear mechanism of injury in terms of like fixed foot.
Yeah, you like, I turned a certain way.
I did this, I felt this.
And I felt this. Or like it could even be an increase in load over time.
So an overuse condition.
I've just been, I played a full week of a tournament and
I'm
now
sore.
I'm sore kind of thing.
Yeah.
There's a reason for the pain.
That's it. So that's what we're talking about.
It's when, nothing has really changed in your life or any kind of traumatic injury and then you're like, and this pain just kind of
comes out of nowhere, progressively worsens or sometimes even stays the same.
Yeah. That's probably another thing, that it's not really aggravated too much by anything mechanical.
That's
really.
it, yeah. And like if you're thinking about like what physios do, like realistically we're looking for mechanical causes of pain. That's what we're aiming to try and treat. And so a lot of the red flags that I use or that I look out for, and I'm sure that you do as well, is to determine whether or not they are mechanical pain.
Yeah.
Because if there's not a mechanical source of symptoms, then it's not really physio.
Yeah.
It's not physio
there's
indicated.
not much we can do to help that. And
that's where you kind of would be sending off for imaging or doctors or specialists if you're kind of thinking different things. So I guess like in terms of like the pathologies that you're kind of screening for, big ones are like malignancies, so cancers, tumours, spinal infections or systemic causes of being unwell. Fractures is another one. I feel like that's a couple of the big ones.
Yeah.
The other ones.
Well, quarter equina,
spinal cord, things that don't really make sense.
Well, yeah, I think if you've lost feeling in both
and legs, you kind of go.
Legs.
But it's actually interesting. So, like, because losing sensation in both legs is actually one of the later stages of cauda equina.
All right.
So, like, it's cauda equina, like, so.
Is it not loss of sensation to the bowels and stuff though?
Again,
as well?
but that's
later?
also later. Yeah,
Righto.
so like your cauda equina symptoms actually are like so cauda equina. So your cauda equina is basically it's called that because it's like looks like a horse's tail. It's the tail end of your spinal cord. So it's your lower spinal cord. So it sort of sits kind of around like that, like L4. I think 3, 4, 5 is kind of where it's basically considered from. And if you have like a significant disc protrusion or disc bulge, basically something starts compressing, or even a fracture something can basically compress that space and basically put pressure on your cauda equina, and then you basically develop these weird kind of symptoms, basically. So like you've got like loss of bladder and bowel is a big one, saddle anesthesia, so like numbness or altered sensation basically through your saddle region, which is basically the inner part of your thigh, crotch region. A lot of what I've been able to find about cauda equina is that often it starts, the thing that people tend to report is it feels like ants crawling on them. So they'll often be one side or both sides, but it's this sensation of, doesn't feel like tingling, but it's like, feels like I've got ants crawling on my skin.
Righto.
Unless you've got obviously like a really acute mechanism where you've had this massive disc bulge or protrusion and you basically cauda equina squished, and then you'll end up with like loss of bladder and bowel or changes in muscle strength, changes in reflexes is kind of the big one. So obviously like with those kind of things you'd be doing like neuroscreening, but I believe the sensitivity and specificity of reflexes is actually the highest in terms of like your neurological exam. So that's, I guess, a red flag from like the physical assessment side of things. But I feel like most of the time, clinically, you kind of have a good idea whether or not you're looking for something a bit off by the time you get to the physical exam, because you would have had a few strange signs. I guess other red flags, like common ones I'll, I guess, screen for is like, kind of your unremitting pain that's not aggravated by anything mechanical, night pain. But then night pain can also be a red herring because inflammation tends to be increased at night. So just because you have pain at night doesn't mean you have cancer. But it is a red flag. What else have you got? You've got signs of, I guess, systemic unwellness. Fever, chills. Obviously, you've got like nausea and vomiting.
Well, or with your head cases and stuff like that, any like your vertebrata, that kind of stuff.
So you got your 5Ds and your 3Ns as well. So like your CADs and your VBIs, you want to be screening for them. So you've got, do you know them off the top of your head, or
your dizziness,
diplopia, which is double vision.
I don't know how to say them, but I know
vision.
What they are. Let's just use it later.
So
swallowing, speech.
dysarthria. You've got your drop attacks. So drop attacks, because a lot of people don't know what technically a drop attack is when you fall to the ground without a loss of consciousness. That's a drop attack. So I think that's also something that's probably important to kind of put out there, because like passing out is not great, obviously, but it's not considered one of your 5Ds. What else have we said? That's 4. Double vision, dysarthria, diplopia, drop attacks. What's the last one?
Jesus Christ, I don't know.
I went through them like a week ago.
I'm trying to think of my subjectives here because I have like a template in my head. It'd be right in front of me, wouldn't it? Whenever I have a neck thing, we've got a little thing off the top that just like makes sure that you get all these things.
So there's dysarthria. So is that... No, is dysarthria...
There's swallowing and speech.
Swallowing and speech.
Is that
separate.
both? Okay,
let me double check.
Let's just double check for the viewers at home.
We're filming this after a volleyball competition. We're tired. So
there it is.
Dysarthria, diplopia, dizziness, dysphagia, swallowing, and drop attacks.
We did get them all. We did get them all.
Which is not the terms. And then your 3 Ns. So you've got numbness, nystagmus, and nausea is the other one.
What's this? Well, do they know nystagmus. Do you know what nystagmus is, guys?
Nystagmus, fancy word. So nystagmus is basically beats in your eye. So it's tested when you're looking for like a VBI screen. What we basically do is we have people turn their head. So we do left and right side, and you need 10 seconds hold and also 10 seconds between sides, because there can be delayed effects. And so basically turning your head to the side, like maximum rotation, we will, lovingly stare into your eyes. And basically what we're looking for is these little extra beats. So they're they're not deliberate extra beats. So they're uncontrolled extra beats, essentially. The thing with like doing obviously like your VBI screens on that, like you're not trying to bring their symptoms on.
No.
And most of the times you you won't.
I was going to say, if you get quite a lot of these kind of symptoms, I generally be like, well, for one, for sure, like, you know, all those D's and whatnot, you'd be like, okay, I won't even touch you before you go get scans.
See, I had a guy come in once with, he had, you know, I was like first year out of uni, he had all 5 Ds and 3 Ns. I was absolutely terrified. Oh, sorry, no, he didn't have nystagmus. That was the one he didn't have, but he had everything else he was complaining of, and he'd been in a motor vehicle accident.
Yeah.
He'd had scans. His doctor had referred him to me. I was absolutely terrified to touch him. Basically, turns out...
doctor had referred?
Yeah. So basically what had happened was that he just, because it was quite a traumatic event from the car accident, he'd basically just... like had this really overwhelming amount of stress and had manifested kind of all of these symptoms.
Right.
He actually had no VBI, no CAD, no other cause of it. It was a true like mechanical whiplash neck stuff, but he just had all of these crazy signs. I was shitting myself when he came into me. I like went out to my bosses and I was like, what do I do? This is terrifying. He's had these scans. I don't want to touch him. Yeah, and he just had like a really bad radiculopathy, basically, with some whiplash and stuff. So, yeah, there are 5 Ds and 3 Ns. So that's, I guess, you know, one other thing we're looking for.
That's pretty much to just like to check that the vertebral artery is well.
It's not.
You're not getting like a cut of circulation or whatever.
Essentially. But then the other thing that's really interesting as well, like if you do have a VBI, your body will actually rework it as well. So you can also not have these symptoms, but technically have a VBI.
Oh, righto.
Yeah, which is kind of interesting.
A bit scary.
Also terrifying. Pretty scary, but, you know, bodies are wonderful.
Yeah.
Yeah, we go, I guess, night pain is kind of, one unremitting, or sorry, not unremitting. That's unremitting night pain is what they class it as. I feel like another one that I'll often look for is like your weight loss. Loss of appetite, like unexplained weight loss.
Unexplained,
and it's normally pretty drastic too.
I always ask that in my subjectives, and like, I wish.
Yeah, that's
literally everyone.
Yeah, there is like, please.
I was like, I don't know. I'm not asking. I'm like, well, it's particularly that I'm asking it for a red flag. I don't think you want to have unexplained weight loss.
Yeah, that's
but
it.
Like, it's just like every single one.
There is like, I wish.
Oh gosh.
You're exactly right. So. That's a funny one.
Yeah, that is a funny one.
People. Ridiculous. I guess like any like kind of significant amount of pain is also kind of a red flag. So it doesn't really fit.
A red flag,
family history of things as well. So family histories of cancers and that's technically considered red flags.
Fine. Is ataxia a little bit of a red flag too? That off balance thing. That usually comes into play with a bit of the necky ones
and you'd have more experience with that as well with the your neuro background as well, which is...
Ataxia is just like really... all of a sudden uncoordinated, off balance, more than, you know, usual.
Basically, if A is in the front of a word, it means like abnormal, essentially. Like ataxia is like abnormal movement. Taxia movement.
That's a little
totally. That's a good tip. Such a loser. Knowing things like that.
That's fine.
Yeah.
But those are like kind of things we look out for. But obviously, that you said there's 163
from your subjective.
Yeah.
So if you kind of put that into, I guess, like, you know, a lot of it just, if it fits a clinical picture, great. Go with that. If it doesn't fit a clinical picture, that's when you kind of go, what else do we need to do? We need to refer on, or we need to get someone else involved. And then there's 44 items from your physical assessment that can be considered red flags.
From a physical assessment?
For a physical assessment. So red flags really kind of aren't great in terms of like they can't really tell you what's wrong, or they can kind of give you an indication that something's not right, but it doesn't tell you exactly what it is.
Yeah. Someone was telling me, like, generally physios will pick up at least 1 or 2 red flags, like a year type of thing.
Red flags? Or significant things?
Like, significant enough to, like, pick up something, like, to go...
We need to shoot you off.
We need to, yeah.
Which is kind of crazy. Like, I've had a few people walk in who... Like, I've had fractures that haven't been picked up, or
That's kind of a common one, I feel.
Fractures are often missed.
It also annoys me when they don't do weight-bearing ankle sometimes. And not that it's like fracture, but also like sinister. All those kind of things. I'm like,
that's it. It's so, it just makes it hard.
And stuff like that,
well, I've had a few fractures. I've been in the clinic, I've had a few people with like, things like cancer get picked up.
Yeah.
I guess like, spinal tumours, I think it's spinal pathologies, those big ones tend to be the big ones. We've had like a stress fracture in like femur that got picked up. That was missed by a doctor.
Honestly, imaging can also, which is kind of scary.
Yeah, and that's like imaging, like there's certain, imaging is not the be all and end all when it comes to picking up pathologies.
You really don't think anything's right.
Yeah, that's it. And that's like another thing is like if people like, trust your gut kind of thing. Obviously there's like, yellow flags. We've got yellow flags as well. And that tends to be a lot of like psychosocial kind of behavioural stuff, which is a whole nother kettle of fish. And so we, but I would say generally for general population, if something doesn't feel right with your body, you know it better than anyone.
Yeah, so it's definitely like just with those yellow flags people though, I still think they're worth like listening to.
100%.
Because that almost like I have so many of those kind of chronic pain patient ones that like my doctor doesn't listen to me.
That's it.
Like, just listen to your patient.
That's it.
And you can
make such a difference just by listening to them, which is crazy. Like that people just don't.
Yeah.
But we also said we'd talk about like threads as well as another acronym we use. We just basically should go through all the acronyms that we use.
There's so many acronyms. I feel like threads is more like contraindications for your treatment, essentially. Just things to like when you're
look out for.
Things to look out for. Like so T in threads means thyroid. Yeah. So they can just more so deal with people's like energy levels and things like that. Or, like,
energy, like basically it'll talk to their like treatment and how they'll go with their treatment. Like so fatigue definitely has a component to that as well. I feel like that's that's generally what you need to look out for, I guess. And then H is obviously heart, so if they have any heart conditions, high blood pressure, heart disease. Things like that, things you need to be mindful of with prescribing exercise and positions in treatment as well.
Yeah, that's very true.
You want to be mindful of that. R is rheumatoid arthritis, so that's like your inflammatory arthritis. So basically like the joints, you end up with these, lots of inflammation. It's obviously quite painful. That will definitely affect what treatment you'll potentially do for a patient, how they'll respond to treatment. So generally I find you have to go quite like gentle in terms of like any kind of manual therapy and exercise, as well as like whether or not they're on any medication for that, obviously, as well. So like different medications, sometimes work really well and sometimes don't.
E is epilepsy. I feel like that's just, obvious one, but people just knowing people's triggers, I guess, for that like kind of thing. Like you can have exercise be
a trigger for it
for epilepsy and whatnot, and how they manage their seizures and stuff. And you more want to ask them what medication or whatever they're on as well.
A is asthma. So again,
obvious.
These
are all like
you guys know what that is. So that's again like exercise, but also again you kind of want to know what triggers in that are as well. I once had a lady who we ended up having to change her session to be outside because one of our admin ladies had gone and bloody sprayed Glen 20 in the rooms, and she just like
had an attack or
couldn't function. People still die from asthma. Crazy. I know it's not.
Doesn't surprise me, I guess.
It just seems crazy to me that I'm like, people literally like...
One of my teammates actually got diagnosed with asthma, and she didn't realise she had asthma until she went over to Asia with all the humidity. The pollution and... Well, just all the humidity, I think. I thought Australia was humid, to be fair.
Australia is humid, but we don't have the same kind of like things in the environment as well. Which is... pretty
And
crazy.
she was like playing AFL and stuff previously, and she never really got it until she went over there and started playing volleyball, and she was just like, yeah, they told me I had asthma.
That's interesting.
Yeah, that's pretty
Because you've got
crazy.
as well like different thresholds, obviously, for asthma
Yeah.
as well, like with your breathing and like air out versus air in, which is interesting. So, because asthma is just like undefined of like it's a component of like your COPD, like your chronic breathing disorders. Yeah, interesting. Asthma.
What are we up to?
Diabetes.
D, diabetes, which...
Diabetes.
Diabetes.
Diabetes. Yeah, overall health. How the treatment again will go. Wound healing.
I always like, generally, if they're about to do, have you eaten? Have you done, like, you know, things like that, you know.
True. Yeah, that'll
Because I've had a couple when I've done some exercise, particularly with my disability back in the day, I'm like, they'll just start getting white. And I'm like, okay, what have you had today?
sugar.
I've had like a banana. And I'm
You're
just
like, where are your carbs? Where are your carbs, bro? Fuck.
Please. But also, like,
Crazy.
I feel like there's sometimes I've come across, well, not sometimes, but I've come across like gout symptoms as well.
Yeah, I've had a few people that have been referred to physio for gout.
Yeah. I'm like,
It's not really much you can do too
medication
much.
for that.
I think as well, like in those sort of senses though, you know, your treatment in terms of your physio is just like education.
Yeah.
What can you do? What can't you do?
Yeah.
Go to your doctor, get more advice.
Yeah, 100%.
This is what you can do exercise-wise. But yeah, I think as well, like diabetes in terms of like a clinical setting, probably like there's obviously considerations, but like in a hospital setting, there's obviously like a little bit more, I think, importance around like wound care and things like that.
Yeah.
I think education comes into it in terms of like in a clinic. I've had like, you know, people want dry needling and that who have had, you know, who have diabetes, who like it's quite uncontrolled and that, and like affected wound healing and things like that. And I normally, I don't really do that because I'm just like, meh, it's not worth it. And
fair enough.
yeah. Yeah. And then our last one is S, just steroids slash surgery. Yeah. And we're chatting a little bit about like steroids and that before we filmed, before we turned you on.
Yeah.
And I guess because steroids, you know, sometimes I think people think, you know, injecting juicing up in the gym, shit like that.
Aesthetically.
Yeah.
Yeah.
But it's not just that. Yes, it is that. Like, you know, obviously risk of infection is high, potentially having like a some kind of like infectious disease or something like that. Hygiene.
Yeah. It's more about like the degradation of like connective tissues and joints and pretty much,
Yep.
that kind of thing. But also like we were talking about, like it's not just the jacking up, jeeping up. It's like, you know, your cortisone, steroids
like
things.
steroids that people are on for like eczema.
Yeah.
Skin conditions if they're on it for like joint pain, like any like, you know, inflammatory conditions like rheumatoid arthritis. People can be on steroids for that.
You started talking about asthma.
Asthma,
Yeah.
So because like with asthma treatment, so like people think of your puffers, but you know you've got your bronchodilators, but then you've also have your steroids, like steroidal puffers as well, and that's again like knowing what that is important, like from a connective tissue side of things, but also from like a, you know, there's long-term effects of being on those kind of medications. And like obviously we're not saying like come off those medications, we're just saying we need to be aware of it. Like I was saying before we started filming, like I had a lady who I asked if she was on any steroids. This is early year. Not this year, years ago, first year out, and I asked if she was on steroids, and she originally she was like, no, I'm not, and then when I was kind of digging a little bit deeper, sorry if you can hear the dog, she was kind of like, oh, I'm on like this, you know, steroid medication, and she was an older lady with like some thoracic back pain. And it wasn't like she did have a mechanism, like she'd reached forward for something and was pulling something and felt something in her back. So she did have like a mechanism and and then asked if she was on steroids. She eventually kind of was like, yeah, I am on steroids for I think it was like an inflammatory lung condition or something like that. And when I said, kind of was like, oh, well, how long have you been on them? She was like, oh, no, not that long. And I was like, okay. Cool. Anyway, and then we did some massage through her thoracic spine, through her thoracic region. She felt a little bit better. Went home, and then she rang me later that day. And that's right, she'd gone after me, so I strapped her back up. She ended up leaving and then went and got some acupuncture through her thoracic spine from someone else. And then she rang me later that day and was like, my back is like killing me. It is so bad. It's way worse than it was when I saw you 4 hours ago. And I was like, all right, well, maybe we need to like send you for like an x-ray, because this is like quite abnormal. Doesn't really fit with like a mechanically type of back pain. And anyway, she did. She went and got a scan done. And she had like, I think like a compression fracture of her thoracic spine. Right. And then, you know, she was like, oh, I was actually thinking about it after I left, and I have been on the steroids for like, I think at this point, like maybe like 9 months or something like that. And I was like, okay, that's not a long time.
Yeah.
That's a long time.
Yeah.
But I guess I kind of learnt from that. I was just like, I need to, you know, if they say, oh, not that long, it's like, yeah, but how long? Like, how long actually?
But it's funny, it's funny how, like, things can be missed in the subjective, and later on they'll just say something out of the blue, and I'm like, wait, what?
Yeah. It's almost like a spidey senses, I feel like. Like, I feel like the hair on the back of your neck kind of stands up.
Yeah.
And you kind of just go, like, something doesn't feel right. Yeah. Like, I've had, again, like, I feel like, you know, trust your gut as a patient, but trust your gut as a physio as well is kind of the other thing.
You kind of need to almost probe and ask more questions sometimes.
And I think sometimes as well, like I worry that I come across as like, you know, overly cautious and too worried and that kind of things. But every time I have like pushed someone to do something, it's come back that it's like I was right in that. Like I've had like a grade 1, almost grade 2 spondylolisthesis that was seen by someone previously, and it just didn't fit with mechanical back pain. And I remember I felt so bad because I was like, I really think you need a scan. I don't want to overstep, but I really don't. This doesn't seem mechanical to me. And then eventually they did, and it was like almost a grade 2, which is like basically where one vertebrae slips forward on top of the other. And the risk with that is obviously like, 1, it's a fracture, so it's bilateral fracture. But 2, the risk of a spinal cord injury, quite high. You've got an unstable spinal segment essentially, so it literally starts pushing forward. I've picked up like bilateral pubic rami fractures, which again, massive instability issue, bleeding risk in terms of your pelvis. Because I had a lady who came in and was like, oh, I had some Bowen therapy and it made it better, and I just want some more trigger releases, and it just didn't fit a good, clear, mechanical clinical picture. And it's always like, I'm always kind of like, something just doesn't fit. I really think we need to push for this. And I've always felt terrible about it, because I'm like, I feel like I'm bullying my patients into going and getting scans or doing things excessively. But then
half
it comes
the time
back.
though, they're pretty like, they're appreciative that you
that you care enough
you're like, hey, look, like,
to not accept
like, just like
failing.
This could be nothing. I'd really just want to make sure though, like, because it could also be something.
Exactly.
So it's like more puts the onus on them. I
also think as well, like, something that I've learnt as well, and I'm still learning, is like, particularly with imaging, if you want to send someone for imaging, like, I'm still learning the whole, like, I guess my previous clinic, I was very aware of what people were spending, and I didn't want to, you know,
and that's fair,
and I was like, I know that I'm expensive to see, and I know that imaging is expensive, and I know that this, and I don't want to have to worry about it, and so, like, that kind of thing. At the end of the day, I'm going to tell people, I'm still trying to learn that, like, you tell people what they need to hear, and you tell people what the best course of action for them is, and it's their choice if they want to pay for it or not. And like, you work within that, because I feel like, like, you know, I'll get like, if you get like, I think 7-8 sessions in and nothing's changing, and then you're like, oh, maybe we should send for some imaging, you probably already kind of missed the mark if nothing's changing. I feel like it's like, you kind of go, all right, we need to be sending this early if we're gonna do it, because it does affect, you know, people's health.
100%. Yeah.
Which is, yeah. We're probably nearly 30 minutes in.
Oh, righto.
Yeah.
Well, I've got my little segment I was going to do with you.
What do we want to call it?
So there's this like patient, but like patient red flags or green flags, and you've got to tell me if it's a red flag or a green flag.
Okay.
I feel like these are fairly obvious, though, to be completely honest. Okay. They wear shorts when coming in for a lower limb problem.
Green flag. Green flag.
Do you know how many patients come in with like jeans and they're like, oh, my knee, and I'm like,
it's literally always. It's honestly always.
I can understand in the winter months though. I can, but like
wear like tracky dacks and shorts underneath. Like I like when people bring a pair of pants.
Yes. Green flag when you wear shorts underneath.
Yeah.
And you're like, oh, I've got shorts underneath. Oh,
red flag when you don't. You just expect to strip to your knickers.
I Googled my symptoms and diagnosed myself.
Red flag.
Red flag. Red flag.
Yeah. Because I feel like half the time they'll be like, I've had a guy who came in and he was like having like some very clear like radiculopathy, and that was it. And he was just like, yeah, like it was fine. But like he literally was just like, what did he say he had? I've got thoracic outlet syndrome. I have all of the symptoms of thoracic outlet syndrome.
Oh, righto.
And you're like,
okay.
Do you have an extra rib?
Yeah.
What's causing this compression? And he was like, I'm just so tight.
Yeah.
I was like,
no, sir.
I don't think so.
At the same time, I've had people come in and be like, oh, I think I've got tennis elbow.
Yeah.
And it's just like...
Yeah.
If you think
you've got something, I think if you come in and you're like, I have this, it's so like, it's hard almost like, because they then have expectations. Like, I feel like the amount of times, so like I've had people come in and they're just like, yeah, I've got tennis elbow. And you're like, okay. And then you do all your tests and you're like, you actually don't have tennis elbow. You have something else. And then they're like, okay. Or they're like, oh, I just really want the treatment for this. Or they'll be like expecting a certain treatment. And you're like, it's not going to fix it.
Yeah.
That's not going to fix it. Like, your expectations are not. And it's okay to have expectations.
Yeah.
But realistic.
All right. I don't want to take any pain medication.
I would say red flag.
Yeah.
Yeah, red flag, because like I don't mind if people don't want to take pain medications as long as like you're reasonable with it.
Yes.
Like if you're like 10 out of 10 pain.
I was going to say, if you're like high pain level.
If you're like walking in or like on crutches and you're like, oh, I can't do anything, but I'm not taking any pain meds. You're just like,
also that means like I feel like you're actually not in high levels of pain. If you're like in excruciating pain and you want to take like, why are you not taking pain medication?
Take some pain meds. It's not for a long term.
No.
Like anti-inflams, like take them for like a short dose. Yeah. It will help and then you'll be better off. Yeah. Or like people, anyway. So like I would say red flag, but also like I can understand where people come from. Like they don't often like putting, I get a lot of clients that are like, I don't like taking stuff and that. And that's fine as long as you're reasonable with it.
Yeah.
If, in saying that though, like if you're, there's
also some that can't take it because they're already on like heart medications or stuff like that as well. Yeah. So you're like, well, okay, we got to do something else then.
Yeah.
Cancelling appointments because they are better, not because they forgot.
Cancelling appointments because they're better.
I know. I think this one's controversial, I feel. I feel like that's more a yellow.
I would say, yellow. I think it could go either way. If they are a person that needs clearance, red flag.
Yeah.
If I've said, I think you'll be 100% before next session, if you are feeling 100%, I always say, cancel, just let me know in an email. Yeah. And then that way I kind of know, and there's been that bit of communication. Because like I find it really, you're probably the same, I find it really rewarding when patients come in and like, I don't want them to spend money to tell me that they're better, but I do find it really rewarding when they're like, I feel so good, I'm not having any issues, I haven't had any pain for a couple of weeks, I just want clearance, or I just want to find the next exercise, I want like the next thing. But I also find it really rewarding when I get an email and people are like, I feel so much better, thank you so much. Yeah. Like it feels like you're part of a team and you've done something. If patients just cancel, you're like, I don't know if you're better or if you just hate me.
Yeah, fair enough. They don't like you.
You're just like, oh, we've seen each other for 6 sessions, but maybe they hate me now.
My wife told me to come in.
Red flag. That's such a red flag.
Such a red flag.
It's such a 70-year-old man.
Yeah.
Who's been complaining of back pain for, 20 years. And
I
there's,
don't
like,
know why
a
I'm in
big
here.
gut.
Or even like my doctor told me to come. That's probably another one as well.
Yep.
Where it's like, oh, I don't know why I'm here.
Don't
my
really
doctor
know why
told
I'm
me.
here.
Yeah.
They just told me to come, and you're like, ugh, bruh.
Does exercise every day and increase some of the reps because they were easy?
Hang on, does their exercises every day and increases their reps? Because they're green flag.
Green flag. Massive green flag.
That's so good. I love when people come in and they're like, I'm like, how many reps are you doing? And they're like, well, you said to do 12, but I actually have been doing 20 because it feels really good. And I'm like, oh, great. I hate
just
when people...
having that health literacy of like, okay, I could probably do a bit more.
Yeah, if it feels good, keep going. I hate when people come in and they're like, you said to do 12, but I just did 5 because I figured I could do 5, 5, 5.
Yeah.
And you're like, no, you meant to do 12, 12, 12.
Yeah. Yeah. Don't understand sets or anything like that. This brings me to, it was painful, but I just kept going.
Red flag.
Yeah, red
it's flag. Like double red flag.
I had one the other day. He was like, I think I was pretty adamant about it, but like, I don't know if he was listening to me. But it's like, he told me the exercise, like he wasn't getting any better. And then he's like, oh, I did so many of the exercise and I was like in pain afterwards. And I was like, oh, like how much pain were you in after the exercise? And it was like 7 out of 10. I was just like, I was just like, how about we stick to like a 3 or a 4 out of 10? Let's not
I always get the whole like, do you get the whole like, what's the difference between discomfort and pain?
Yeah.
I'm normally just like, if it's above a 4 out of 10,
don't
keep doing it.
Yeah, exactly right. So, I want you to, it can be uncomfortable.
Things are allowed to be uncomfortable.
Yeah.
Things aren't allowed to be painful.
Yeah. But like the thing is, you can't go through 3 sets of an exercise in the session, right?
Yeah.
And so like you put it on the onus to be like, you know, do what you can.
Yeah.
And whatnot. You think you educate enough, but obviously you're not.
Sometimes
I'm like, mate, it was causing that much pain. Don't
I always
do it.
like, so many times I'm also like with people, I'm like, just do this amount because you're better to have good quality than quantity, shit quantity.
Yeah.
Like, do it well, do 5, do them well, build from there. If you're doing 10 shit ones, if you're using the same motor pattern that you've used for the last 25 years, it's not going to get you anywhere. Do them and do them well.
Yeah.
And sometimes they don't.
They bring their gym program into the session.
Green flag. I love that. Yeah. I love when people are like...
proactive-ish.
Generally, yes.
Yeah.
I have... Yeah. Sometimes most of the time, green flag. I have had one guy who was way too over the top, and I think also thought he knew more than he did.
Yeah.
And it was just very you've been doing this for 6 weeks and it's not improving. Don't tell me what you're doing that's because obviously it's not working. But most of the time I would say green flags. I've only had one red flag for that, and I was like, ugh.
Has a health and exercise background.
Again, I would say generally green flag because I feel like then they're educated.
Yeah.
But I guess it depends on the background. If it's they're actually educated in it, yes. If they're someone who just does it for a hobby and thinks, they're a nutrition expert because they have abs and it's they're giving shitty advice. No, red flag.
Yeah, red
flag. I think depending on the background,
I tried physio before and it didn't work.
If they're coming in with that mentality, it's a red flag.
I know, it's a red flag for me as well.
Yeah, because you're just
okay, then why are you here?
Then why are you here? Just to make me feel like shit.
Yeah. It's you're almost trying to have to change their mind.
Yeah.
And it's that buy-in's already not really there.
Yeah, that's exactly right. Same with the whole I've had I see my osteo, but I can't see him on the same day as I see you. And you're like, okay. Cool.
When they come in and say, I'm not going to do my exercise.
Oh, red flag. Just get out.
Just get out. What are you here for?
Yeah.
On the same breath, I only want massage.
Red flag, get out.
Another red flag.
I'm literally, yeah.
Yeah.
Nah, if they, I've actually had someone, not even a client, someone who I was living with as a housemate. And they said, Aunt Physio is just like glorified massage therapist. And I was like, she was like I don't know, she took, like, not a pathologist, she just used to run blood stuff. I literally was just like, and like my best mate who's an EP, one of my best mates who's an EP, was like sitting across the table from me. And as soon as she like said that, I like just turned and looked at him and he was just like, couldn't. He was just like, he's an EP. He was just like pissing himself.
Words.
He literally was just like just a glorified massage therapist.
Yeah. 4 years.
I was like 4 years to learn how to touch people. Yeah. How good.
Awesome. Comes in for preventative physiotherapy.
Love. Green flag.
Green flag.
Green flag.
Comes back in, finds exercise really helpful, but wants to keep doing exercise.
Green flag.
That's
so
you know
good.
what I love is when like people who haven't got an exercise background and we
They
introduce
love
it.
exercise.
Yeah, and then we introduce it, and then they're walking every day or they're doing.
They start
things.
doing stuff.
Yeah.
I love that too. I really love that. That makes me happy.
Yeah, that makes me happy too.
Good for the soul.
Those were it. That's all I had. I don't know if I had any more to really. Do you have any? Red flags in patients or green flags in patients?
I feel like this is just taking like a stab at people, but it's literally just like where they're like, will you work with my chiro? My chiro says my neck's out.
Yeah.
I need help with my neck because my chiro says my neck's out and I can't get in to see them.
Yeah.
Red.
Red flag. I had a lady come in actually who I don't even know, but I don't know what her official title was, but she worked in Reiki, like she did that kind of medicine, and she's like, I was trying to do it on myself, but I couldn't really do it, and then she came in to see me. Just like, okay.
I was saying before as well, I had a guy come in the other week and was like, so what certificate did you need to like do this? And I was like, oh, it's like a 4-year bachelor degree and I'm doing my 2 years of my master's now, so like a bit more than a certificate.
Yeah.
A little bit more, but yeah, wild.
Did you end up going down to Melbourne?
Yeah, I did. Yeah. It was good.
How'd that go?
It was really good. Shout out to my friends that I made down there.
Oh,
made some friends.
Yeah.
Did
you do practicals?
Yeah, so it was practical. So it was really cool. So basically like a week. So it was 4 days. We did 11 courses, like or 11 bits of content over 4 days, which was hectic. Basically learning from like top physios and specialists and like...
Oh, that's so good.
So cool. So intense, but so cool. Basically just like getting feedback from handling and things like that. And then the last day was we had like practical exams. So we had like some OSCEs and that, which was terrifying because I haven't been in an in-person exam for a while, but it was cool. Like got really cool feedback, which was good, and at the end of the day it's just basically to make us like better clinicians, which is cool.
And did you find results and stuff, like if you
haven't
passed?
checked. I assume I passed. Hope so.
Fingers crossed for it.
Fingers crossed for you guys. Fingers crossed.
Yeah, cool.
But it was good. It was fun. I learned a lot.
So
it was really good. I like came away being like a lot more confident in things and like just with like a better understanding of some like extra tests and like hot tips and that kind of stuff. So it was really good. Like really actually keen to kind of get back into it.
That'd be awesome. Yeah,
I think I technically get my results in like 3 days, to be honest. I don't think
maybe we can put that on social media.
Put my grades out there if I pass or fail.
If you don't see anything on our social media,
just assume I failed and I'm going to like quit.
Kidding.
Nah, I'm sure it'll be fine. It'll be fine. So I think I go back not next week. I think it's the week after. So I still got 1 more week, and then I think I have to go back down to Melbourne in November again.
Awesome.
Which will be sick, and then placements in that next year, which will be cool.
Yeah, so good,
fun.
so good. Yeah,
but no, it was good. So and Beck just got back from Vietnam.
I did. It was so good. I liked it. Being back with all the Bollywood girls again was so good. Yeah. But it was so weird being on like the manager side of it. Well, the staff side.
The staff side, yeah.
The staff side of it, because like some of the girls I played with last year were still there. So it was just funny, just setting a boundary in a way. Because like I still wanted to hang out with them and I did, but it was also like
line.
I needed to like be more with the coaches and and treat them obviously, and have a bit more of a professional kind of
rapport with them.
But I think having that rapport with them previously, they were more comfortable.
I was gonna
with
say,
me.
yeah, and they would have felt trusting of you.
Yeah,
which is pretty
exactly
cool.
right. So it was really good, and thank the Lord, or whoever else out there. Whoever's out there, there wasn't any major injuries. It was just like management of like some overuse
stuff.
Yeah, stuff. So nothing too crazy, thank God. But they are still on tour, so it might just knock on wood for them. So nothing
happens. Yeah.
Because I swear, like a year or so ago, it was just like this person fractured their ankle, this person broke their finger, this person,
Oh my God.
and it was just like crazy
Overload.
on tour, and I was just like,
See,
oh my
the physio
God.
did such a good job with like prevention.
Right.
That's why they didn't injure themselves.
So good.
That's it.
But also, like, it was more the fact that if I have to take them to hospital in this random friggin' country, like,
What the hell?
That's probably more what I'm more worried about.
Yeah.
Like, just being in a separate, like, healthcare system and just, but...
Oh, we've had some crazy injuries at the rugby lately. Mm-hmm. Wild. Actually, the whole season's been, like, fucking riddled with crazy injuries.
That does not surprise me at all.
It's wild. Rugby, next level, insane.
Yeah.
Like, volleyball, much more comfortable.
Yeah.
We had a concussion over, like, yesterday.
Yep.
And the guy was just like, he's so sweet. He is so sweet, except for on the court. Like, and I guess, like, you're getting fucking pummeled by 120 kilo boys. He just was like dead silent. He like got knocked out. Like, but you couldn't really see, so I like run on, the other physio runs on with me, like at the other side, and we get to him, and he's just like not talking to us. I'm like, you have to talk to us. You've got to talk to us. We need to know what's going on. He's just like sitting there on his hands. And then he's like, no, I'm good. It's my shoulder. And we're like, no, stop. And then the refs are like, is it a blue card? Which was like concussion. And we're like, just got to figure out what's going on. And then we're like, what half is it in? He's like, first half. And then we're like, who's scored last? And he's like, no one's scored. And we're like, yeah, it's a blue card. It was like 20-12 or something at that point. Like, there had been like a bunch of tries. And he's like, he was just like, he's like, no one scored. I'm like, ew, get off.
Oh,
Blue card, off we go.
Yeah.
And then, so sweet. And then, I walked him up to the med room and he's like, fuck. So aggro. And then he like comes down to the end of the game. So it was like 20 minutes in, and he comes to the end of the game. He like walks on and he like gives me, he's like the sweetest, like,
biggest teddy bear?
Yeah, biggest teddy bear.
That's
he comes
cute.
over and like gives me a hug and he's like, sorry for being aggressive.
Sorry for yelling.
Sorry.
I'm so sorry.
Can you tell me what happened? And I was like, oh yeah, this is what happened. He's like, oh shit, I don't remember. I don't remember any of it.
Darn it. Oh, no.
He's so sweet though. He's such a sweetie. They're all sweet. They're all lovely boys.
Lovely.
They're really kind. Very nice.
Cute.
Had a compound dislocation.
Righto.
That was pretty
gnarly.
I was just like, because he big dive, like the big tackle, jumps up, other team scores, and then he comes over and he's like, oh, my finger.
Yep.
And I was just like, blown out, and I was like, yep, we're off.
Yeah.
And he's like, gotta go off for this? I was like, yeah.
Mate, your finger's a whole different way.
I was like, your finger's this way and the bone. Yeah, you need surgery for that. Broken jaws. We've had broken jaw.
Yeah. You were telling me, I think you've told me, is it a different broken jaw?
No, same broken jaw.
You were just like, it was like...
Poor guy, so he's like done his MCL as well now.
Oh, bloody hell. Yeah.
Very
I
crazy.
find that if they dislocate their finger though, they'll just quickly do it.
A lot of them do, yeah. This was open though.
Oh, yeah.
This was...
Oh, yeah, sorry, yeah.
This was a compound. This was like bone sticking out. I was like, ugh.
Oh, did he thought you could fix it?
I don't know. He came over and he's like, oh, my finger. And I was just like,
strap it up.
I literally was just like looking at it and I was just like,
Taking a picture?
We've got an open dislocation, maybe a fracture. Fuck. And then he's like, oh, I gotta go off. Like, yeah, but
man.
He looked like he was in so much pain though. There was like no way I think he would have continued
But the fact
going.
that like, yeah.
Yeah, he was like, I gotta go off for this. I was like, yeah. Yeah, you do.
Mate, you
do. You do have to go off for that.
Yeah.
So,
oh my gosh.
I think we've had dislocated shoulders, dislocated fingers.
Yeah, all right.
Like, yeah, lots of
Oh
wild
my
ones.
gosh, some wild ones, yeah.
Wild ones.
Fun. Maybe put a picture of that on the social media.
The crazy injuries, hey? That'd be so funny. I feel like,
Well, did you hear Nico's story? I'm going to have to get it for him.
Nico.
On Interclub.
Is this one of those stupid injuries?
Yeah, he had a stupid injury.
What's our thing? From the bench.
From the bench.
From the bench.
The crazy
From
ones.
the bench, final segment.
Well, Nico's...
Shout out to Nico.
What he was doing. He did it at work, so it's a work public claim. And he was trying to break, like, styrofoam. Yeah, did he tell you about this?
I heard him say he was trying to break styrofoam.
On the ground, and he just kind of went to, like, cut it or,
with
like,
his finger.
punch it. And
with
he just and somehow he went through the styrofoam, hit the concrete floor, and he fractured his finger. He broke his finger. Like,
fucking hell,
idiot!
That's a wild way to do that.
But he's also still in pain after 8 weeks, and he has to go see a specialist.
Shit.
Yeah.
Jeez.
Yeah.
I love that you're laughing about it. You can tell you guys are close. That's wild.
It's fine.
He'll be fine.
He'll be fine.
Shit.
Good job, Nico.
Good job, Nico.
Anyways.
Damn.
We should probably...
I think we should end that there.
Wrap it up there.
Yeah.
Oh, jeez Louise, that would be a good ending.
That
just
would
completely knock the table over.
Tea on the thing.
Tea everywhere.
We've got our mugs.
You got a new one today.
Is this new? I mean, it's new maybe to the podcast, not me like dissociating live on camera. Live on camera. Yes, it says, today I choose to be a unicorn. It was actually given to me by one of my clients. I think she's adorable. Like little 8-year-old girl.
Yeah.
Absolutely gorgeous.
Do you know what would be nice if we got so big in our podcast that people started sending us mugs? That would be, I feel like that would be like, we made it.
Guys, make it happen. Just share our shit.
Just like,
get us out
give
there.
Us mugs.
Yeah, give us some mugs. We want a light sign.
Yeah.
That shit's expensive to make.
Yeah.
I was looking at it.
Oh, did ya?
That shit's
over
expensive.
$1,000? Yeah. Tax time?
Yeah, it's like,
surely it'd be taxable if we actually earn
If we
money.
made money. If we made money, we'll start putting Spotify ads on, and then you guys know what that will be. No. We'll be making it.
Oh, yeah, for sure.
Wild. So, anyway.
We'll wrap it up there, guys.
Yeah.
Bye, Benchwarmers. Bye.
Let's hope that